Welcome to Corrective Exercise number 16. I'm Anthony Carey with Function First in San Diego, California. Once again, I have Jeff Groh from Authentic Motion with me. If you haven't been to the Authentic Motion website, authenticmotion.com, Jeff and his wife Elizabeth have some great articles up there, some real good information for health pros, and they're both Gray Institute gift fellows, so lots of good information up there. Corrective Exercise number 16 is going to be, what we are going to do is take a modification of the Thomas test, which is a hip flexor assessment test that we can look for contractures in a single joint or two joint hip flexors. We're going to take this particular test and make it into an exercise. The test basically looks like if Jeff were to lay down and I'm going to have him bring his left knee to his chest. I'm going to slide back just a little bit, Jeff. This would be for the one joint hip flexor. Keeps the lumbar spine flat on the table. We want to see if the back of the knee's coming up or if the hip's in flexion. If we want to see if it's the two joint hip flexor, I'd have Jeff slide towards the edge of the table a little bit more. And then we would see what happens here at the knee. And if the knee stays in extension, then we've got some tightness in the two joint hip flexor. If the knee does fall into flexion the way we want it to, then the test is negative. But what we're going to do, we're going to take advantage of this particular position for some of our clientele. We may find that some of our clientele who need their two joint or even their one joint hip flexors don't have a great deal of stability. So if we wanted to have them do it kneeling or standing initially, whether it's because they're a senior population, because they're previously sedentary, or because they've actually been experiencing some pain and they're very guarded, that their stability for getting after their hip flexors is limited. And in fact, when they're so unstable and they're worried more about their balance, we never actually get them to relax and allow the tissue to lengthen because they're constantly in this protective mode. So having them laying on the table puts them in a safe environment. What we'll do with Jeff is I'm going to actually have him scoot forward a little bit so the axis of his hip joint is about the edge of the table. And if this were my client, I'd have him sitting up just like this and kind of sit on the edge of the table. And then I'm going to have him lay back and grab one knee. So I'm going to have him grab his left knee as he lays back at the same time. So again, for somebody that's got some back issues, or our seniors, or somebody just in general is a little bit apprehensive about moving, this is a great way to get them down. Now what we're going to do is we're going to cue Jeff to keep his low back kind of flat on the table. So now what ends up happening, we do have a bit of an abdominal exercise here because the tension on the hip flexors, tight hip flexors by the way, is going to create some torque on the lumbar spine. So if we have the individual on the table using their abdominals and working to keep their lumbar spine flat, they're working against the torque that's created by gravity on the leg here. Now we're also going to get a little bit of distraction, meaning gravity is going to be pulling on the leg, creating a little bit of space here. And doing such, we get a little bit more separation through the proprioceptors in the joint. So that's not a bad thing for us either. As Jeff's lying here, we can see that he's got a pretty tight hip flexor. We might also see some clients through their lateral myofascial line here that are tight, and then their hip will abduct in this position. So one of the nice things about this exercise is this can be done independent of us at home for a client. So again, as a corrective exercise, that's part of what we want to have happen. We can always just prop the back of a chair. If this is their dining room table, they can have a tall back dining chair right against here to keep this propped. So as Jeff's lying in this position, he's working his abs, and now we're getting some passive release here. Now because Jeff is as tight as he is, this may not be the best exercise for him because he's probably got some fascial changes within the tissue here. Things are pretty tight. We want to be able to get this hip to drop at least below the plane of the parallel for gravity to get some advantage and take it into hip extension. Now when your client's working with you, obviously you can apply a little bit of downward, very gentle downward pressure if you're so inclined. And in some cases, if I want to get both hip flexors, I'll actually straddle the foot, apply a little downward pressure, in other words, increasing the knee flexion, and then a little downward pressure here on the thigh to increase the stretch. So now we're getting both hip flexors at the same time. If I was not available and Jeff was doing this independently at home, we could make this an active stretch. I would cue Jeff to plantar flex, and then bring his heel back towards the table without flexing the hip at the same time. And that's the challenge that some of your clients will have. As they go to flex this knee, they're going to want to flex the hip at the same time. So as long as he's keeping his hip down and he's plantar flexing, now what he's doing is he's lengthening through the anterior chain all the way up into the hip. And you can relax there. If we wanted to make this exercise a little bit more of a strengthening exercise and still put the abdominals and the hip flexors on an eccentric load, because believe it or not, some people out there do have weak hip flexors. I could have Jeff bring this knee up, and then I'd have him lower it and just drop it all the way down, and as he drops, we're going to, as soon as he gets to his end range, I'm going to have him bring it right back up. So as that leg is dropping below the parallel, the abdominals are going to kick into eccentrically, control what's happening at the lumbar spine, and then as he flexes again, we've eccentrically loaded the hip flexors. So this can be a great exercise to promote positive sagittal plane motion here of the hip flexors. Now, one last thing I want to talk about, we also sometimes use this exercise, and I've used it in the past for clients that have had some radicular symptoms and that have also had some compression in the facets on the same side, because we may actually want to use the passive lumbar extension that will happen through the weight of this leg. So if Jeff is not completely pressing his low back onto the table, we're getting a little bit of extension into his lumbar spine, what's going to happen is the vertebral bodies will rotate away from this leg, and the lumbar spine will slightly laterally flex away as well. So if it's his left leg, if it's his right leg, the lumbar spine is going to be rotating left and slightly laterally flexing left. Maybe not so much laterally flexing as much as there's going to be a little bit of gapping between the facet joints. So for those of you that are much more well versed in what's going on in the lumbar spine, we're actually going to create some space through here. So if there is some nerve impingement in the leg, we very often have had a very positive result for clients when we allow the lumbar spine to passively go into some extension here through the weight of the leg, versus having them prone and doing a press up, something like that, when things are very asymmetrical in their lower back. So you can bring this back up, and you can sit back up. And of course, we would typically do this on both sides. And most importantly, we want to be able to empower the client to do this on their own at home. Simply being done on a table can be very effective. So we take the Thomas test, we turn the test into an exercise in this case, and there's a lot of different applications. Thanks for watching. Corrective exercise number 16 at functionfirst.com.